Hi, I'm Dr. Kevin Mailo, one of the co-hosts of the Physician Empowerment Podcast. At Physician Empowerment, we're dedicated to improving the lives of Canadian physicians, personally, professionally, and financially. If you're loving what you're listening to, let us know. We always want to hear your feedback. Connect with us. If you want to go further, we've got outstanding programming, both in person and online. So look us up. But regardless, we hope you really enjoy this episode. Hi, everyone. I'm Kevin Mailo with the Physician Empowerment Podcast, and I'm very honored to have as a guest today on the show, Dr. Kerstin de Wit. Dr. de Wit is a professor of emergency medicine at Queen's University, a very active clinician and researcher practicing both emergency medicine and thrombosis medicine, doing research in both fields. And I reached out to Dr. de Wit because I was reading an article in the National Post, and I'm going to highlight that in the show notes, featuring survey data from a study that was done in the Annals of Emergency Medicine, published in June of this year, 2024. And in it, essentially, Dr. de Wit and her team highlight the incredibly high levels of burnout amongst emergency physicians and really provide a very human look into frontline work in our healthcare system. And, of course, as an emergency physician, this really struck me very deeply. So with that being said, let me hand it over to you, Dr. de Wit, and perhaps just tell us a little bit about your professional and academic journey.
Thanks so much, Kevin. And it's a pleasure to be here with you today. I originated in the UK. I trained in Scotland and then went through residency programs in internal medicine and emergency medicine in the UK, and also trained in research there. And I ended up moving to Canada in 2010, actually to do a thrombosis research fellowship to learn a little bit more about both the clinical and research aspects of thrombosis medicine. And since then, I met and married my husband, and I've stayed in Canada since then.
Wonderful.
I currently split my time clinically between emergency medicine and thrombosis medicine, and I work about 50% of my time in research.
Wow.
And the research is mostly focused on how we test for pulmonary embolism and deep vein thrombosis, and also how we test for intracranial bleeding in older adults.
Wonderful.
And this study just came as really a byproduct of the pandemic.
Yeah, so let's jump into it. It's a longitudinal survey-based study, but tell us a little bit about the dates, the times, how you deployed this study.
Yeah. So right back in mid-March 2020, shortly after the pandemic was declared, a lot of research was at a standstill. All of our research teams had to leave the hospital, and a lot of clinical medicine was also at a standstill. And my research team told me that they really wanted to contribute to the work for the pandemic. So they really wanted to feel useful. And out of that, we developed a survey study. So we used the skills that we already had within our team to develop this red cap survey, where we advertised broadly all across Canada. And we advertised in the first maybe 3 to 4 weeks of the pandemic. And we recruited physicians from almost every province and territory, both academic and community physicians who are working in emergency departments. And at the time, we surveyed them actually every week for 10 weeks. And we asked them about their burnout levels, as well as their experiences with working shifts and contracting COVID. And from there, we turned the survey into a more of an intermittent survey study. So we now have a cohort of almost 700 physicians across Canada, and we're surveying them intermittently. So we surveyed them a second time towards the end of 2020, and then we surveyed them again 2 years after that in the fall of 2022. And those surveys had focused much more on well-being and levels of burnout.
So tell us a little bit about the key findings of the study.
Yeah. So we were able to compare the results that we got in the sort of winter of 2020. So during the first year of the pandemic, towards the end of that year, we were able to compare the burnout levels that we measured then to the fall of 2022. So almost 2 years difference. And we found startling levels of burnout. That's the first thing to say. So even towards the end of 2020, there were high levels of burnout. So roughly 50% of physicians who are participating in the survey exhibited high levels of burnout. But when we surveyed them again in October of 2022, we found that those levels had increased really significantly. So we measure two elements of burnout: emotional exhaustion and depersonalization. And emotional exhaustion had increased by an absolute 16% of our cohort. And depersonalization had increased by an absolute 12% of the cohort. So the sort of levels of measurement looked a lot worse.
Absolutely. And, I think it's probably worth highlighting that at around 50% for burnout, right? I mean, if you want to use it, all encompassingly, that's exceedingly high.
Yeah. And it's important to say that this is high burnout. So everybody had some level of burnout, but this is the cutoff that distinguishes high levels of burnout from, we might say, more everyday levels of burnout.
Like it was bad before the pandemic, and it's only gotten worse. And then can you just elaborate a little bit more on depersonalization, Dr. de Wit?
Yeah. I think we're all a little familiar with depersonalization. It's that feeling that you're so sort of worn out that you don't really have the emotional connection with your patient. It's hard to both appear caring and connected to the patient and also to feel that way. Sometimes we can see it in colleagues and sometimes we can recognize it in ourselves when we're really exhausted, where we're used up and there's nothing left to feel that emotional empathy.
I think a lot of people describe that as the going through the motions, right? Saying things that, are you're supposed to say without necessarily feeling that.
Yes.
And, it can occur between, physicians and patients and families, but also amongst each other with, nursing colleagues or other allied health. And then, of course, like burnout is never, we do a lot of teaching and talking about burnout, in the physician empowerment program. Burnout's like, there's always this spillover effect, right? Chronologically, right? So if you had a really difficult shift on a Monday, there's no reason why you're going to be completely recovered and ready for Tuesday, right? And these things can compound on each other. I think the other important notion of this spillover is not just chronological, but obviously between personal life and professional life as well. That it takes a very real toll when you go in and work in these difficult conditions. One part that really spoke to me about the survey was the qualitative aspect. So at the end of it, you had this optional section where physicians could share what they were feeling. Do you want to just highlight some of this?
Yeah.
Because this was a lot, right? I mean, this was hundreds of physicians.
Mm-hmm. Yeah. And we specifically didn't want to make that compulsory to fill something in because we wanted people only to tell us if they thought there was something worth telling us. So we asked them a very open-end question. We said, is there anything you would like to tell us about your experiences? And then we gave them an example. So for example, are you feeling differently now compared to over the past 2 years? And we didn't really know what would come from that, but we thought, let's just do it in one question and we'll analyze it using qualitative methods. And about half of the participants responded to the question. And overwhelmingly, the responses were very negative. There were very few positive, uplifting stories, and most of the discussion was around how hard things were.
And obviously this is a very general question, but what broadly were people saying? What were they expressing?
Yeah. After we got our data, we did our quantitative analysis first. So we looked at the bare numbers and worked out the progression of the burnout from 1 year to the next. And then I think it was about February, following the closure of the study, we looked at some of the quotes that people had written in their answer to that question. And it was absolutely heartbreaking. So I got the greater researcher group together and we sort of broadly, as a broad overview, we read through hundreds and hundreds of quotes, and it was truly heartbreaking. People talked about lots of different aspects, But the most common thing that was touched on was the fact that people felt that the way that healthcare is organized in Canada today is completely broken. And they felt powerless to do the best thing for their patients. So they felt unable to provide the care that patients needed. And they felt unable to change that or advocate for their patients because there was really nothing available for them.
Absolutely. What were were there suggestions that people brought forward?
Yeah, and I've been asked this a few times.
Besides like blow it all up or,
Yeah. Actually, I don't think we had anybody give a suggestion within the response to that question. But we were able to look and see what people, were there positive quotes and what were those about? And there were a handful of people who had managed to step back from the emergency department and take time off. So some people had taken time off because they just couldn't bear working there anymore. Others had reduced their shift load. There were some people who had taken maternity or paternity leave. And everybody who mentioned that said that was the one thing that helped them.
That's very interesting. And we talk about occupational exposure, right? Like if you're, constantly exposed to, like radiation levels or whatever in some kind of job, I mean, you have to take breaks. But I think we don't appreciate the notion of the emergency department as a work environment that carries health risks to physicians. What are some of your thoughts on physician well-being as a safety matter for patients, right? Because I mean, we're constantly talking about patient safety and outcomes, right? And we talk about system level changes. We talk about a lot of metrics, door to admission time, bed capacity, ORs. I mean, we're constantly talking about metrics at a system level and response times, those sorts of things. But tell us about like what you feel in terms of healthcare well-being and how that ties to patient outcomes.
It's absolutely vital for the workforce in healthcare. And there is very good research done, mostly in the United States, relating the Maslach burnout inventory levels, which is the same scoring system that we used in this survey, to the risk of making a serious medical error at work. So high levels of burnout, as recorded by that questionnaire, correlate to making mistakes at work. They correlate to leaving work, so actually leaving the profession, correlates to depression and thoughts of suicide. So at a system level in healthcare, having burnt out physicians is very dangerous because the standard and quality of care will go down and there could be serious mistakes made. But at a personal level to the physician, it's also very dangerous because of the risk of depression, potentially suicide. And if you left the profession, very few people would have a sustainable alternative option.
Absolutely. Absolutely. You highlighted, we sort of touched on wellness, and this was, quite poignant in terms of being able to step back, and, it's sort of one of the things that we teach is creating that financial and personal capacity to sort of step back from the job at times in our life when we need to, because sometimes there is no changing the environment. I mean, I think that was one of the key messages that came out of the study, right? Because you highlighted, I know when they interviewed you in the newspaper article, highlighted how uniform this was, right? It's not like, oh, well, you're just going to go down the road and find a different department to work in. I think we're all struggling, and we're even seeing it in the popular media now.
That's exactly right. I think it's a Canada-wide problem, even though healthcare is a provincial issue in Canada. And I don't think anybody has solved the issue. And one of the quotes that we recorded was somebody saying, no amount of added input to their department for wellness, little wellness things or
more wellness modules,
wellness activities. Yeah, no amount of that could in any way touch to help the way they were feeling. We have a psychologist in one of their co-authors, and she really said to me when she read those quotes, we're sort of almost past burnout and we're dealing with moral injury. and getting into the realm of, psychiatric diagnoses.
And I think it's probably worthwhile if I could just read this quote here that was in the article, because this was the one that really struck me. And here it is from one of the surveyed physicians. I'm so tired of people talking about burnout. What I'm feeling isn't burnout, it's moral injury. No amount of self-care is going to get my patient to the operating room on time today when they need it, or a bed to be in. It's about being handicapped and unable to provide patients the level of care I am trained to provide and that patients need and deserve. And I think that's the immovable part here, that a lot of us struggle, because there's that gap between what we want for our patients and what we know should be provided and what we can practically deliver on a day-to-day basis, that big gap.
Yeah, I think the powerlessness has a large role to play in how badly that affects us.
And are you seeing any jurisdictions or any hospitals, any initiatives that are you think doing things better? Like, are you getting that sense? I mean, I know that's a little outside of the scope of what we're talking about here, but I'm always curious on, okay, well, here's the problem, but where is, are there some steps that can be taken to improve things?
Yeah, I haven't seen any single place where things are improved. I think the biggest challenge across Canada for the past few years has been that we have lost physicians in emergency medicine. And one of the barriers to highlighting that is that we don't have a registry of emergency physicians, because emergency physicians have so many different backgrounds. So even if you look at the licensing background, that hides all the number of physicians who work in emergency departments across Canada. So there's really no way to measure accurately how many people have left. But I think we all know colleagues who've left emergency medicine, either retired or gone to a different specialty, or else left medicine as a profession, really. So I think that's left all emergency medicines short of physicians. And so the one thing that would have helped us would have been to allow us, when we felt exhausted, just to take a month off or 2 months off or whatever, just not to work if we wanted to. But I think there's been no department in Canada that had that luxury. And actually the opposite happened. We had to work more when we were exhausted and tired and distressed. We sort of had to double down on our shifts.
And sort of what I've been seeing has been that quiet stepping back as well, where, and this is not unique to emergency medicine. I mean, we see it in family practice as well, because I do very limited amount of family practice myself. But, I can't pick up extra shifts. I can't do extra clinic days. I can't see as much or stay in the department as long as I used to. Right? Or people just moving from full-time to part-time because they struggle to, for lack of a better term, continue to be exposed to that dose of the work environment, if I can be perfectly blunt. And so people, for their well-being, are stepping back, even if it's not an out-and-out quit or retirement.
I think that's right. It's self-preservation.
It's self-preservation, right? And then unfortunately, as that happens, the burden falls on a fewer number of those remaining who are able to work at that level, right? So that's the other side to this, right? Is that as people are stepping away, the burden's falling more and more to the few that remain. There's a lot of pressure on the system all around. I mean, I certainly attribute a big part of this to a shortage of family physicians myself. From what I've heard talking to doctors across the country, is a lack of access to primary care leads people, is leaving people sicker, delayed diagnosis, lack of chronic care, or simply just not even able to see a doctor.
Yeah.
So the emergency department becomes the place to go to.
And I think the pandemic just uncovered a chronic issue that was getting worse year by year, that was becoming unsustainable. And then when we add the pandemic to that mix, and then the loss of physicians and burnout, and loss of family physicians, it is just exposed an under-resourced specialty.
Absolutely. So Dr. de Wit, I want to thank you so much for taking the time to come and join us today. Did you want to share any final thoughts or reflections, or maybe where you're thinking about going in this direction? Because this, I think, has been really a watershed and, another step forward in realizing how serious the problem is. Because we keep talking in healthcare like, oh, well, this is just temporary, right? I've heard that for close to 20 years now, since, being a medical student, that the crisis we face seem to only be temporary, but they're always there. I mean, we're always, I remember hearing about hospitals in Ontario that were consistently over 100% of capacity and just do not have days when they're anything less than 105, 110% of capacity, right? So where do you think you might want to go, or what are your closing thoughts here?
Yeah, and I can't tell governments, what the solution is. It clearly is a lot of
very
extra money, like a lot of extra money. But I know, in the States, where many hospitals are businesses, they've been measuring burnout for years amongst their staff, and protecting their staff against burnout is actually high priority for them. I wonder if if burnout levels in general in emergency departments in the States are lower than they are in Canada for that reason.
Yeah, that it's a priority.
Yeah, because it protects their patients from medical errors.
And there is, like, again, I do not support US style healthcare at all. Not interested. I had a patient actually last week who came in and said that when she had her appendix out, it was a $37,000 bill down in the US. So I just roll my eyes at that. However, one thing I will highlight, though, is that notion of the patient as not only a patient, but as a customer, right? And so, like, when we talk about depersonalization and the emergency physician or any attending physician, being disconnected, appearing disinterested, tired, unengaged, that's going to leave an impression with patients as they are paying their $37,000 appendectomy bill. So I think, like, US hospitals are at least a little better along that line. There are many other reasons to be burnt out working in the US healthcare system, but certainly, at least in terms of the day-to-day physical work environment, I think some are doing it better. Not all, but some.
Yeah. And I think I could highlight there were a couple more findings which are consistent, actually, right across all, like, our previous survey and other studies, that we found depersonalization was associated with being a newer physician or a younger physician. So we could do a better job at supporting new physicians entering our specialty, because if they leave, then we're even worse off. And also emotional exhaustion was associated with being a woman.
Interesting.
So I think those could be two areas that we could try and add additional resources and help.
Like stronger mentorship programs. I know some medical schools have now introduced coaching throughout one's training, but you feel kind of like you're thrown into the deep end when you graduate, and you're just expected to pull your weight.
Yeah.
So more support for younger physicians coming up. That's something we can do. You know what I mean?
Yes, and I would love to see hospitals organizing a system that allows physicians to take time off when they need it.
I think that's outstanding.
And to recognize it.
I think that's outstanding to be able to step back. Yeah, because I think, like, what does it feel like to have a month or two off, like truly off?
Yeah.
For any of us.
Yeah.
Yeah.
And we're in the process of planning a repeat survey. We thought maybe the fall this year might be a good comparison.
Very, very good. Yes, because now that the pandemic is well behind us, right? But we know the issues are unchanged.
Yeah.
We know the struggles are unchanged.
Yep. And I'm hoping that we can actually capture the number of people who have left the specialty also with that survey. We'll wait and see. But we're hoping that would be a little bit more informative.
Wow. So again, Dr. de Wit, I really want to thank you for coming on the show and sharing this. And I think this is part of the very frank conversation we need to begin having within the profession about working conditions. And this is not only acute care, right? I mean, this is, family physicians and specialists out in the community who, are trying to do their best for their patients, but are struggling with, whether it's red tape or a lack of resources. Things just need to be better. Thank you so much.
Well, thank you so much. It's been a pleasure talking with you.
Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at physempowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@phys.empowerment.ca. Thank you again for listening.